All right, folks, sound check. Can everybody hear me?
Yes, sir.
Okay,
Yes, sir.
great.
Yeah.
Yes. Thank you very much for coming on the call today. This is going to be a real quick call to do the overview of the BP1 supplemental HPP grant deliverable we have this year, the Coalition Response Plan. Has anybody seen my video as well?
I can.
Okay, yeah. You can see my map in the back of me, the United States map from the 3rd grade. Sorry about that, but that's what I have right now. So I want to go over first a few of the response plan highlights for this year. Last year, one of our biggest deliverables was the preparedness plan. I want to thank everybody for submitting their preparedness plans through the Coalition Assessment Tool. And this year, our big deliverable for this year will be the Coalition Response Plan. Each of our coalitions are to develop a finalized Coalition Response Plan by June 30th, 2019. And if you can mute your phones, please, so I don't have any background noise. We will likely require submission of a draft response plan into the Coalition Assessment Tool by April 1st, 2019. And we did that same thing with the preparedness plan, where we had you folks submit a draft of the response plan, of the preparedness plan rather, back in April of this year. And then you had April, May, and June to finish it up and come up with a finalized plan. Completed coalition response plans are necessary to meet a benchmark performance measure, which is the percent of coalitions that have a complete and approved response plan. If you could put on your mute button or *6, that would be helpful. I'm hearing some background noise. So some of the required components of the coalition response plan. So the response plan, each of the HCCs must describe the coalition's operations that support strategic planning and information sharing and resource management. Those are the 3 big components of the response plan. The plan must also describe the integration of these functions with ESF8 lead agency to ensure information is provided to all local officials and to effectively communicate and address resource and other needs requiring ESF8 assistance. In cases where, and this is a big one, in cases where the HCC serves as the ESF8 lead agency, the HCC response plan may be the same as the ESF8 response plan. Response partners at the table. As you can see here, we have the 4 core members of a healthcare coalition, as it's stated in our guidance for the grant: hospitals, emergency medical services, emergency management organizations, and public health agencies. Those are your core members. Those are the core members we want at the table to input based on their the area of medical response that they are responsible for, to be the main 4 partners when developing these response plans. Now, that's not saying that if you have somebody on your planning team from long-term care or from nursing homes, that you cannot include them as well. We certainly want them on that team, but these are the 4 core members that we want at the table when you're developing these plans. Okay. So let's talk a little bit about the content of the plan, because you're going to see here that when I go through this list, There's going to be some things you've already worked on possibly, and that you have plans, possibly components of this plan already in place. You may have to review it, maybe update it, but there's a lot of things in this plan I think many of you have already worked on before, and you can certainly use when you put together sort of your response plan portfolio. First of all, we're looking for individual coalition member organizations and their contact information to be part of a plan, of the plan. Now that could be in the form of a list of contacts, or if you have some kind of information sharing platform that you use, you can direct people to the information sharing platform to contact people. But generally in a response plan, you're going to want contact information, especially for some of the leadership of your healthcare coalition. Also, locations that may be used for multi-agency coordination. So if you have a place where you go to stand up an EOC somewhere, maybe it's out of a hospital, maybe you're working out of county emergency management and you're working the ESF8 desk, if your coalition's running ESF8, which some of them do in the United States, we want to have the locations and the description of those locations. You want to have a process to describe how you coordinate with different agencies when you are running an operation virtually, which many of us do, you know, especially all the information sharing platforms that we use now. We do a lot of virtual EOC. We want to have a brief summary of each individual's members' resources and responsibilities. So for instance, if one of the hospitals within your healthcare coalition is involved, they have, say, a cache at their hospital of medical equipment. Maybe it's a Western shelter that you use as a alternative care center or a mobile hospital. Well, we want to have a brief summary of those resources and the responsibility of that particular member of activating those resources when requested by the coalition. We also want you to describe what's the integration look like with appropriate ESF8 lead agencies. So for instance, if the state is the ESF8 lead agency, which it often is, how does your coalition integrate with the response with ESF8 lead agency? So that can be things like, how do you communicate when there's resources that are needed, or if there's some sort of situational awareness that the state may be looking for? How is that shared, and what are the processes in place for integrating with those lead agencies? We're also looking for emergency activation thresholds and processes. You know, I call them triggers. You know, what triggers your coalition plan to be activated? Not all events that happen within your coalition, as you know, within your regional boundaries, warrant the coalition to take some sort of action. You may have an event at a hospital that is contained at the hospital. It's not at all overwhelming the resources. They have no needs from the coalition. But yet, you know, when an event occurs, and of course, those processes and also some of the resources that are needed by the coalition or by that individual facility, you have to make these trigger points. Now, so it could be, for instance, it could be you know, you're having a medical surge event and you have to shelter in place, or you have to evacuate some of your patients to a different area of the hospital, and you need some assistance for that. Or you're having a medical surge event and your ER is totally overwhelmed, and you're going to need that Western shelter or that some resource from the coalition. Maybe it's at another hospital and it needs to be moved to where the event is occurring. You set up triggers for that. activation thresholds, alert and notification procedures. And now we do that a lot, right? We do call downs to test our systems, but what are the alert and notification procedures for when an event happens at your hospital? How do you notify the coalition so they can take action on your behalf? EEIs, emergency elements of information, right? As agreed to be shared, including information format such as bed reporting. We do this, resource request and allocation, and patient distribution and tracking procedures. We want to see that you describe that in your plan. Excuse me, I said emergency, essential elements of information, I'm sorry. EEIs, essential elements of information. I was at another call this morning on the UAC thing, and they used another term that was similar to that. So EEIs, essential elements of information. We've done a lot of work in this, and of course, you know, the last couple of hurricanes we've had, Hurricane Harvey in Texas, they learned a lot about that essential elements of information. So bed reporting, resource request, and allocation. How do you distribute patients, and what are the tracking procedures when you are distributing patients? Now, not all coalitions will have complete capabilities to do a lot of this. Some coalitions, although they may have some tracking procedures in place, they may not be involved too much with patient distribution. Maybe it's a state responsibility or mainly an EMS responsibility, and the coalition sort of involved with situational awareness. But we at least want you to put together that process, even if it's not your responsibility. We want you to tell us whose responsibility it is and how it unfolds. Communication and IT platforms and redundancies for information sharing. So this is another big one. We've spent millions and millions and millions of dollars on information sharing platforms. So we want to know how you communicate. Maybe it's through EM resources, WebEOC, and there's many other platforms out there. How do you communicate? And if one of your communication pathways has been disrupted in some way, what are the redundancies for information sharing? We have email, we have, you know, WebEOC, EM resources, we have ham radios, we have 800 megahertz radios. We have various ways to share information, but tell us a little bit about what is the redundant systems that you have in place to make sure that you can continue to communicate when there is some level of disruption. So the next thing is support and mutual aid agreements. Very important. And a lot of this, again, we have developed these mutual aid agreements over the last several years and support agreements. So you may have all of these already in place. All you simply have to do is put it as a part of the response plan. Of course, evacuation and relocation processes. You have, within your boundaries of the coalition, you may have developed plans around patient evacuation and relocation. They may be state plans, they may be regional plans, they may be local plans, but share with us what those plans are, and again, how are they activated when they're needed. The third piece to the response plan content, I want to flesh out a little bit here because it's very important. Activation of, excuse me one second, we have a big mission going on and our phones are blowing up. Okay. Activation and notification processes for initiating and implementing medical surge response coordination among coalition members and other topics related to medical surge. So we're looking for strategies to implement if the emergency overwhelms regional capacity, or specialty care, including trauma, burn, and pediatric capability is in play. We're looking for strategies for patient tracking. We're looking for strategies for patient distribution. And we're looking for processes for joint decision-making and engagement among your members among state and local public health officials, emergency management organizations, to avoid crisis conditions based on proactive decisions about resource utilization. So we're looking for processes of decision making. If you want to go back to the example I made, if a hospital needs some sort of resource that is owned by the coalition, and possibly that resource is housed in another facility, again, what is the decision-making process to activate that asset during an event? Like I said before, this is a benchmark performance measure for the budget period 1 supplemental year. We're calling a supplemental year because we are starting a brand new 5-year project period next year, starting July 2019, with a new grant, totally new format, and another 5 years of funding. So what we're looking for here is having a complete response plan by the second budget period, which is the BP1 period we're calling, BP1 supplemental period, and 100% approval by core member organizations of each HCC. So it's that core member organizations, public health, hospitals, emergency management, and EMS. We want 100% approval from all of those core members. And of course, you're gonna send out the plan to all of your other members as well, and have them, look at the draft and maybe input some of their ideas into it. But I would strongly recommend that even though you share with everybody, keep a strong, small group of core planners together so you can get this thing done. Sometimes when you have too many people working on it, too many cooks in the kitchen, the planning process gets sideways on you. So 100% of additional member organizations have been provided an opportunity to provide input, okay? And then they will all receive a final copy of that response plan. And of course, you're gonna upload it to the coalition assessment tool, the draft being in probably April 1st, 2019, and then the full one by June 30th, 2019. Here are some of the planning resources that are available to you. And I'm going to send out the slide deck after this webinar so you can grab the links here. The first one is the 2017 to 2022 Healthcare Preparedness Response Capabilities. That's on our phe.gov site. I have a link to it here. That's going to explain the capability the deliverable that we are asking you to do this year of the coalition response plan. And it has some other response and preparedness capabilities in that manual as well you may want to take a look at. If you want to look more about the performance measure 5, to beat the benchmark for this response plan, you could go to our performance measures implementation guidance. That manual has been around for the last year. It started in our first year, and it'll give you some more information, more clarification on what a complete response plan is. So you may want to take a look at that. Also, Asper Tracy, which is our technical assistance site, has a healthcare coalition response plan template that you can download. It's in PDF form, so it's not like you can jump right in there and put in your own information, but it gives you a lot of ideas on what could you put in a response plan. We're looking for the content that I just shared, but it may have some more additional information in that response plan template as well. I strongly recommend that you go to that website, download it, and take a look. Another good manual would be the FEMA Developing and Maintaining Emergency Operations Plans. If you need a little bit of understanding on emergency planning, a little background on how to put together a planning team and how to put together some of your core members and how they interact with the team, and how to set up an emergency operation plan team that you can activate right now. Because we're in the new supplemental period, so this is when you should be working on this plan, is starting right now. So there's a lot of good information on there. In my next webinar, which is going to be a month from now, I'm going to talk a lot about that manual. Also is the MSCC, the Healthcare Coalition and Emergency Response. This is an older manual. Back in 2008, ASPR developed it. But Dr. Yeski, our new Principal Assistant Deputy Secretary, he put together that manual, and he's bringing back a lot of that information as we move forward with this idea of a regional disaster health response system. So I urge you to take a look at that manual as well. The entire manual has good stuff in there. With the preparedness and response capabilities, I think the HCC response plan is on page 15. I may be wrong. It's around page 15, 16 there. So you want to look at that. And also there's good information in page 47 as well when you talk about the coalition response plan. My next response plan webinar will be Thursday, August 16th, 2018, from 10 to 11. It's going to be an hour this time. And I'm going to go over some planning fundamentals. What do you need to know when you're planning for any kind of response or any kind of plan that you are developing? Some of the considerations you may want to bring to the table, and the planning environment. We're not just building a plan for our coalitions. The coalition is part of the larger ESFA picture, right? So you're going to be working with state partners. You're going to be working with the feds. So I'm going to talk a little bit about the federal response and how you integrate the federal response in what you do. Then we're going to talk about format and function. And this is going to be the most important part, because there are basically two types of formats for emergency plans. There's an emergency operations format, emergency EOP format, and then there's an emergency support function format. And we're going to talk about what they are and where do you think, or what type of format that you should have for your coalition plan. And then I'm going to talk a little bit about the planning process and how you can make that process, with all the limited time that all of us have, make that process pretty easy, and how you can share the responsibilities with different partners and bring it all together and have a completed plan by the end of next year. So with that, that's the end of my webinar today. It's a real quick overview. I encourage you to go into all of those manuals and look for the different topics related to the coalition response plan. I've got 6 minutes left here until I got to go to another meeting, but does anybody have any quick questions? And if you don't have, I really want folks to reach out to their states with questions. And I may tell you that just ask your state, because your state does it a certain way, and I don't get involved with how you do it really. I just tell you what you have to do. So if you have a question, I can answer it usually, but if I feel like it's a question that you should be asking your state, I will tell you that, and then you can ask your state about it. And of course, if the state doesn't know, they will pass it off to me. Anybody? Any questions?
Hi, Bill. This is Jessica Dupree at NICTRAC. How are you?
How you doing, Jessica?
Pretty good. Quick question for you. We've done a lot of work with the pre-planning in Texas, but I wanted to get a little bit clarification on the support and mutual aid agreement. Mm-hmm. Are you looking for those to be an example or appendix of those agreements, or who has those mutual aid agreements? What does that look like?
Right. So I'm sure that, North Central Texas RAC, you probably have many mutual aid agreements, right? And
correct.
You have support agreements. If you could at least list them in the plan And these plans could be electronic too, right? So there could be links in there that you can go to the actual plan and open up and take a look at it. Or you could take the support agreements and the mutual aid agreements that you have in place and put it as part of the overall plan, a hard copy that goes along with it, and you can submit it that way. And we're looking for mutual aid agreements on, alternative care sites, if you're going to move around patients, support agreements with EMS services would be a good example to put in your plan. If you have support agreements from critical infrastructure like the power companies or the water company, put them in there. That's a good idea to put them in there because that's usually a regional situation when you have a water disruption or a power outage. So those are some of the examples.
Okay, thank you.
You're welcome. Anybody else? Okay, folks, what I'm going to do is I'm going to send out a copy of this slide deck, and I'm going to also send you out an invite for the next workshop or the next webinar, and that will be on the planning process. So I hope to see you back in about a month when we go through that 1-hour webinar. I want to thank you very much for coming on the call today. I appreciate your time. It's hot out, and I know you've got a lot going on. Hopefully you understand where we're coming from here. I wanted to make it short and sweet so I don't overburden you with information. But again, reach out to your states if you have any questions. And if they can't answer your questions, they'll come to me. I appreciate it. Thank you very much. This is the end of the webinar.